This week's Ask Dr. Durie comes from a patient confused about some recent test results. The problem is that a bone marrow test was done which showed that the bone marrow appeared to be clear of myeloma. However, blood testing showed that there was still myeloma protein, a small monoclonal spike, present in the serum. So this patient asked, what does this mean? Well, there are several reasons for these apparently conflicting lab test results. The first answer to this question is that it could possibly relate to the timing of the tests. The serum protein is broken down in the body, a process called catabolism, and this occurs over a period of a few weeks, even out to 2 or 3 months. And so what that means is, although the myeloma cells which produced the protein in the bone marrow have been eliminated, the protein in the blood is still slowly breaking down over time. And so there can be a disconnect where the cells are gone, but the protein in the blood is slowly breaking down. So that can be one reason. A second reason is that there is persistent myeloma protein in the blood, and that's because there is protein coming from plasma cells outside of the bone marrow. What this means is that there can sometimes be what's called a plasmacytoma, an area of myeloma outside of the bone marrow in a soft tissue location. And those can be just about anywhere in the body, actually, and are the sort of things that can be picked up with a PET CT scan, which screens the body to see where could there be a pocket of myeloma cells outside the bone marrow. Another answer to this problem is that maybe with more detailed testing of the bone marrow, a few abnormal myeloma cells might be found. And this is what is done with MRD testing, minimal residual disease testing. And so this is a method that is now being more routinely applied to see if 1 in a million cells or even less might be a myeloma cell. And so this type of more sensitive testing might have revealed that a small number of cells are still present in the bone marrow and capable of producing a small amount of protein. And so the bottom line here is that there are several reasons for this conflict in the lab test results, and additional testing is required to try to clarify the problem. And so if it's just a timing issue, follow-up testing in the blood should reveal that the M protein will in fact disappear over time. Perhaps a PET CT scan could reveal that there is a plasmacytoma outside of the bone marrow. And perhaps an MRD test might reveal that there is a small amount of myeloma in the bone marrow. And so these are important issues for the patient to discuss with their doctor and decide what other action might be required. It could be that just ongoing monitoring will be sufficient to see how things evolve over time. But important to be considering these different possibilities to explain this type of conflicting lab test result.